Hi guys, so I was gonna make a video about the surgery itself and just like the symptoms I had after surgery and what happened the day of surgery and just the whole experience because I had already kind of talked about the results after the surgery and like where I'm at right now in terms of like the journey of having this thyroid cancer. But basically, the day of surgery, it was the day before surgery, they call you and they tell you what time your surgery is going to be the next day. I don't know if every hospital does it this way, but the hospital I had my surgery at does it this way. And actually, I work at that hospital also. Um, so basically, they told me I had to be there at 5, so I had to leave my house at 4 o'clock. They didn't tell me that, but I had to leave my house at 4 o'clock in the morning. I wasn't allowed to eat anything after 11, and I think they did that probably because I was having an early morning surgery. Maybe if you have it a little later in the day, they tell you midnight. I know most of the time it's midnight, but I think because I was the first surgery, they just wanted to have me 100% with nothing in my stomach. So I think they say like the standard is like you shouldn't have anything 6 hours before surgery, but I guess you just want to be extra careful. So anyway, I got to the hospital. I was very, very nervous. Was not looking forward to it. I have 2 little boys, and I don't know. I never had surgery before, so it was really scary. But I want to do the right thing. That's I think everybody wants to try to do just what's best for them. So I went. They check you in, I guess. My husband was with me the whole time. My mom was watching my boys here at home. Um, so they didn't really know what was going on. They're really little. They're 4 and 2. But my mom was here with them for when they woke up and everything. Try to make it as normal as possible. We just told them I was going to be at the doctor's. So uh, they took me in. They asked me, the intake questions and kind of did a quick assessment on me. The nurse got my IV started. I think they may have given me Zofran for nausea before surgery because I told them that when I had had my wisdom teeth removed, I was nauseous and vomiting after whatever the anesthesia was that they gave me for the uh, wisdom teeth removal. So they gave me Zofran, which is a medication that combats nausea and vomiting, basically. So they gave that to me before surgery, and as they took me back to the operating room, that's when me and my husband parted ways. I was still awake for the time like we went into the operating room. That was like really scary. I think that was the scariest part of everything. Just because you're like there, you see all this stuff all around, and you're like, oh God, this is where I'm going to be, and they're going to be operating on me, like Final Destination. But so they they told me they were going to give me this medication for like nerves, basically. It's like having a cocktail before surgery. I actually don't even know what the name of the medicine was, but they put that in your IV and kind of gets you a little loosey-goosey so you're not so stressed out about going like the going under part. Then they asked me to wiggle from the bed that they were pushing me onto the operating table, so you're like still awake as you're getting onto the operating table. So I wiggled over, and I was feeling that like kind of like woozy feeling, and then the guy was talking to me, and I was probably starting to get a little loopy, and then they put this mask on me, and I still, it bothers me. I don't know if that was the anesthesia or if that was oxygen. I don't even know. So I was telling the girl, the last thing I remember was telling the girl, like, I feel like I can't breathe because they like were shoving it on my face. And that was it. I don't remember anything else. I don't remember waking up. I don't remember up until I was actually in the post-op area. And I forget what that's called. Oh my gosh. I'm in nursing school and I don't even know like the actual term of the area. But anyway, so I was there and I was talking to the nurse. I think she offered me a popsicle and I was like all excited about that. But the popsicle she gave me was disgusting. And then I realized at that point I was having nausea And I felt like I was going to throw up, so I told her about that. So with this, apparently, I didn't realize it at the moment, but they don't want you throwing up because it could, well, I'm sure they don't want you throwing up, period, but it could, what is it called? Like, I guess the pressure, the increased pressure from throwing up could disturb the incision, so they didn't want me doing that. So they tried to get me to take, they didn't try to get, but they offered me more for Zofran, and I'm like, well, can I just throw up? Because I probably would just feel better if I just threw up. And I just didn't want to take any more medicine because I'm just a difficult person. But they, the nurse, and I really, really appreciated it. She gave me a little thing of lavender, not the plant, but she gave me, like, I guess it was like an alcohol, I don't know if it was a hand sanitizer or what it was, but she put, it was like a strong smelling lavender liquid on the little gauze pads, and basically she's like, just smell it, and it works with like cranial, there's a science behind it. It works with your cranial nerves. I forget which one, the olfactory, whichever number that is. And it like overwhelms that nerve so that it disrupts the message to your brain that you're nauseous. So, and it actually worked for me. I didn't throw up, and I, like, if I would sniff it really strongly, it, you know, like kind of overwhelm, I guess, that sensation of me having to throw up. So I really appreciated that, and it worked for me. So I'm going to remember that when I become a nurse. Um, and she's like, I do this, like, you know, she buys it out of her own pocket and brings it. And I'm like, well, I guess that's better than having to deal with vomit. So I guess it works out for her. But it was nice, you know, she really cared about her patients that way. So anyway, that was that. I think when I first woke up, I was in pain. It wasn't terrible though. That's what they told me it was going to be like. It wasn't terrible pain where the incision is. It's more because you're intubated during the surgery, which was my scare. I think the thing that was scariest to me about the surgery was just knowing I was going to have a tube in my airway. That was, I don't know, it's just scary for some reason. It skeeved me out. So that's the most uncomfortable thing about the whole surgery and recovery, is that you feel like you have to cough a lot. And I was coughing. Like, I heard some people say like, oh no, you're not supposed to cough, like in videos I had watched, and I coughed and they didn't give me a hard time about it. Because I knew there was junk in my lungs, and like you can tell like all that crackling, and it would get caught. And then the other thing was my voice was really weak. It's crazy. It's only been a week, but I feel like I'm already so far removed from that. It's like you forget so quick. But yeah, my voice was definitely really weak because this is like the most normal I've sounded since I had the surgery. So I guess it's good I'm doing the video now. And this is also the best I've looked since I had surgery because I actually put my makeup on and I straightened my hair today. Not that you can see, but I actually went to a birthday party today with my family. So it was nice to get out, and everyone's like, oh, you look so good considering you just had surgery. And I'm like, yeah, well, you should have seen me like a few days ago because I did not look like this. But yeah, so I was hoping that they were going to give me the option to stay in the hospital overnight because, you know, I just thought if I came home, I was going to feel that pressure to start performing my responsibilities around the house. And I asked the doctor, and she's like, no, we're not really going to give you that option. Like, we want you to go home. So so I had to wait until the nausea completely went away, and I guess they wanted to see me eat something. So my husband went over to the cafeteria because I know it's good over at the cafeteria because it's where I eat my lunch and when I'm at work, and he got me some frozen yogurt. And all the nurses were like, oh, well, do you want some pudding? We've got pudding here. And I'm like, no, I want the frozen yogurt. I don't want your crappy popsicles. I want the frozen yogurt. So he went and got me that, and they let me go home. And I was definitely weak on my feet, I think just from all the medication, but I had like walked to the bathroom, so they saw me walk. They knew I could walk. But you know, it was just like kind of like I was still recovering when I went home. So that day, I think I just laid on the couch, but I was actually able to eat, like I said before, and they tell you you can eat anything you want, but your throat is really sore. after the surgery. And the other thing too that really bothered me was my limited range of motion of my neck, because I, like, the way they had the bandage, it was almost like they had taped my neck down, which makes sense because if, like, to keep the incision closed, it felt like my neck was stuck like down like this, and that's how I was walking. Like, I wasn't able to really move my neck more than maybe like this, which is another reason they say you shouldn't drive for a week. This is actually the best it's been. Like, I still can't go all the way back like I used to. That's pretty good. I mean, that's more than I've been doing. But I had very limited range of motion on my neck. Mostly I feel like it was because of the Tegaderm bandage, which you can take off 2 days after. So I guess I'll fast forward to that point. I got to take it off and see the incision, and I was really scared of that, and it was fine. Like, it doesn't look that bad. I think the scariest part was seeing all the, like, purple marks and just, like, wanting to see it, but I was impressed it didn't look as bad as I thought it was going to. I don't know if you can see it. I'm not a professional YouTuber with the, great lighting, but she put it in the natural crease of my neck. And I was off school, I think, well, my first day that I had surgery on Friday. My mom was with me all weekend on Sunday, and then she went home Sunday night, and that was and my husband was going back to work. He was off all weekend. And, so that was the first time I was, like, on my own with my kids, and I managed. It was fine. I made it through. The first day, Monday, I was still a little, like, rough and felt like I wanted to sleep a lot. But I was fine. And then it just, each day, like, progressively got better. It was almost like every time I went to sleep and woke up, whether it was a nap or from sleeping, I felt progressively better. Now, the one thing that I should talk about was specific symptoms that I don't know if you should look out for, but that I was told were things I should look out for in my discharge paperwork. So when you have thyroid surgery, whether it's a total or partial, you also have parathyroid glands around your thyroid. Now, I don't believe that they're directly connected to your thyroid, but they're connected slightly. So when they do the surgery, they can, I don't know if it's like they take them out or they move them, but they may affect your parathyroid if you have thyroid surgery. Now, they told me they didn't touch them, they didn't go near them, so they should be fine, that they should be operating 100%. So they did tell me, some things you might feel if you hear hypocalcemia. Now, the reason you would be hypocalcemia after thyroid surgery is if your parathyroid had some trauma. So because they said they weren't touched, I shouldn't have any kind of symptoms of hypocalcemia. But they still told me about the symptoms, which would be tingling around the mouth or tingling at your fingers and toes. And I actually did have those symptoms. Like, I felt that, and I actually am feeling it right now. So all week after the surgery, this is like the first week, I've had the tingling fingers and toes. And I did have, okay, that's the other thing. From the innovation, my whole lip was swollen on this side right here. This was all swollen from the innovation. It's still a little sore and numb, but it's not, this is like 99% better than it was earlier in the week. But so anyway, I had these symptoms of the hypocalcemia, and I would just drink milk and milk and milk because it's a really weird, uncomfortable feeling. And I was kind of broke last week, so I couldn't, like, just go out and buy it. That's how broke I was. I couldn't just go out and buy a calcium supplement. So I was drinking tons of milk, which I feel really guilty about because I give my kids lots of milk, and I was drinking all their milk. But I just felt like, this has definitely got to be related to the surgery. I've never had this before, and they're telling me, even though I shouldn't have it, have hypocalcemia, I'm having those symptoms. So I drank the milk, and then yesterday, my husband on Friday, when he got paid, we went out and got me a calcium supplement. So I started taking that, but also yesterday I went back to school. Like I do 2 days at the hospital and 1 day in class. So I went for my 1 day at the hospital on Friday. I gave myself a whole week up until yesterday, and I went back. And when I was driving, I'm holding the steering wheel, and I started feeling the strangest sensation in my hand. My entire hand was pulsating, and like down to my fingers. It wasn't like a pulsing of blood. It was like an electrical pulse. And it was so weird. I was like, okay, I really need to call the doctor. And then the other thing was at clinical, as I'm sitting down writing my notes of like, the patients or whatever I was writing, I can see my face like twitching. Like I saw my cheek like moving, and I'm like, I'm not crazy. I know these things are never have happened in my life. And I had just had surgery where they're talking about tingling, and I know like a twitching and electrical things could be related to calcium. So I called the doctor and told her, and she was like, no, well, we didn't touch your parathyroid, so it shouldn't be an issue. And I'm like, and I didn't tell her this, but I was also reading online that even though they didn't touch them, maybe just because they removed some vascularization in that area, it could affect them. And I wasn't going to challenge her because doctors don't like to be challenged. She's a very nice woman. She's very sweet. But still, it was just like, I could tell she wasn't taking me seriously. That's my biggest pet peeve is like, you need to listen to the patient. The patients aren't, maybe some of them are lying to you, but you still need to listen because that's where medical mistakes happen. So she's like, oh, are you drinking enough water? And I'm like, yes, I'm drinking enough water. I didn't say I was drinking enough water. I said I've never drinking enough water. I don't ever drink enough water, but basically saying nothing's different than it. I'm not doing anything differently than I've ever done. And I never had this problem before surgery. So anyway, she's like, well, just keep drinking water. You're fine. And it's like, well, no, you don't know for sure that I'm fine. You're giving me a guess. But you need to listen to what I'm telling you and take it very seriously. So she didn't. And so I'm like, all right, well, I guess I'm going to play my own doctor until, like, this is my attitude. I'm like, well, if they're not going to listen to me, then I'm just going to have to wait, do whatever I can do until I can find a doctor who is going to listen to me. But it's frustrating being the patient in that situation because people need to take you seriously. And I'm a tech right now. And I've seen, and I still want this to be my thing when I'm a nurse. And I might sound naive right now, but I've seen patients, and I haven't been doing tech work long, but I've seen it where patients will tell me something because I'm kind of like the middleman between the patient and the nurse sometimes. Like, if, they need something, I have to go to the nurse and tell the nurse whatever the patient's saying or wants or whatever, if it's something I can't help them with. So, I'll give you an example. One woman one day was telling me her pinky was hurting. And I was like, oh, okay, like, can't be that serious. I've just never heard of someone saying, like, their pinky hurt unless it was, like, something they did to their pinky. And I'm asking her, like, oh, did you hurt it? Did you, like, lean on it weird? Or she's like, it's excruciating pain. So I'm like, oh, can I see? And she holds up her hands. And her whole hand's fine, but her pinky, just her pinky, was bright red. It was just crazy. So anyway, I told her nurse, and her nurse is like, she's fine. She's fine. I'm like, her pinky's like bright red. Like, could that be like a blood clot? I'm like thinking like, and even if it was, it's like in your pinkies, how bad could this blood clot like be? I don't know. I just never heard of it. So, but anyway, it's just those kind of things where the nurse immediately discounts what the patient's reporting. And even me, like, I was like, your pinky hurts? Okay, well, big whoop. But like when she showed it to me, I'm like, that doesn't look right. Like, so anyway, it's just stuff like that. Like, you should be taken seriously. If you're experiencing something, it's real. You're not faking it. Even if it's not reality, you're still experiencing something. So the doctor should take that seriously. Anyway, after that rant, So I'm back to normal. It's been 1 week plus 1 day. Today's Saturday. I had my surgery last Friday. And I feel like I'm almost back to normal, which is amazing. I still have the steri strips on. But I mean, and now it's more just like, okay, now going forward, what am I going to be doing? Because like I said in the previous video, when they got the results back, they showed that there was some cancer in one of the lymph nodes. It was very small and they don't know. So what the doctor was recommending is potentially recommending, she's not sure yet, but was taking out the other half of my thyroid. And I have quite a problem with that because I don't like the idea of being reliant on medication. That really is scary to me. And with how I'm feeling now, which isn't terrible, but just like the little twitches and the pulsating feeling in my hand, like I don't want to do more damage to my body. I mean, like I can recognize that giant, lump in my thyroid, it wasn't giant. I think they said it was 3 centimeters of cancer, but that was cancer. It was cancer, and I'm glad I got it out. But at the same time, like I want to cure my cancer. I don't want to just keep taking the cancer out of my body, because that's not going to fix the cancer cells. If those cancer cells, which they found in a lymph node, if that had spread or does spread somewhere else, the cancer is just going to go somewhere else, and then they're going to have to take that out again. Or, I want to get to the root of the problem. I want to fix why my body's making cancer and why my body's making lipomas, which is another thing I had done on the same day on my hip. Maybe I won't show you guys that. It's not very glamorous, but I had a lipoma on my hip that they removed on the same day as my thyroid nodule. And so I'm going to start talking to a holistic doctor, and I'm going to see what they recommend, because they talk about a lot of these abnormal growths and how you can just eat healthy and that will cure the cancer. I know it sounds crazy, but why wouldn't you try it if it's something you can do to better your life? I mean, who knows? I could get cancer and I could die, or I could step out tomorrow and get hit by a truck. But if there's something I can do to keep myself around longer for my kids, I think I have the responsibility to do it. And I know better. It's not like I'm naive. I know that these things happen because you're not healthy. And why are you not healthy? It's because your body's not getting what it needs. You need the natural foods. That's what God put on this earth for us to eat. And that's what people have been eating for however long people have been on this planet. And it's just now that we have all these great processed foods that just taste so good, but they're just not good for you. And there's been a lot of research on like high blood sugar levels, and not enough research, but you hear a lot now, like high blood sugar levels are related to, there's insulin resistance with diabetes, and that's like a very obvious in your face kind of thing, because the blood sugar levels are very critical in diabetes. But they don't talk about potentially other causes, like other things that high blood sugar levels could be affecting. But it is associated with a whole bunch of other problems. So that's because we're eating lots of sugar, lots of carbohydrates, lots of processed foods, when we really should just be eating natural stuff from the earth, and we'd be a-okay. So that's what I'm going to have to start doing. I've been a bad girl with the way I've been eating, but now it's time to kind of grow up and do what's right and what I know is right. And that's what I'm going to do. So I will update you guys again. I don't know if I covered all the symptoms, but that was basically my story. I had the really croupy throat. It was very painful. It was mostly just the throat from the intubation. I'm still dealing with the cough from that. It's not completely gone, so that's a little frustrating, but I'll talk about that. I'll update you guys on the next video how I'm doing with the throat, maybe, if I remember, because obviously I'm not very consistent. So I'm going to try to keep up with it. Next Friday I'm having that meeting. It's actually a Skype meeting with the natural doctor, and I'll let you know how that goes. All right, bye.